In this upcoming video, we're going to discuss the details of stem cells with Dr. John Urse. We hope you get the information you're looking for. So John, you had mentioned the stem cells being a treatment option for arthritis. And first of all, can you tell me what arthritis is? I think there's a lot of misconception about exactly what arthritis is. That'd be a good starting point.
Well, arthritis comes from various forms. There's some that is a wear and tear form called degenerative or osteoarthritis. Some people get arthritis from rheumatologic problems, gout, or other what are called inflammatory conditions. But either way, the cushioning effect of the cartilage, which is the gristle at the end of a chicken bone, we all have seen that white cartilage, that's what causes a spacing and a cushioning to let our joints move and move freely without pain. As we lose that cushioning or softening, you may have heard the word chondromalacia, which is a word for softened cartilage. And that softening, as it progresses, causes the bones to rub on each other. So in a picture of a knee here with a space between the bones, the cartilage is good in a normal knee. As a weight-bearing x-ray shows, bone on bone occurs when cartilage wears down, and then the bones rub together, much like a missing brake shoe pad on a car. It just hurts.
So the bone rubbing on the bone is what gives the patient the pain they have.
Yeah, because bones have nerve endings. That's why if you've ever broken a bone, it hurts, because those edges of the bone are now rubbing against the other bone in the knee.
So what I'm hearing then, John, is if you're saying these stem cells actually have the ability to regenerate cartilage, if you inject a stem cell in an arthritic knee, you would actually see that space again?
Well, not right away, and that's a good question, Brian. There have been some studies, and some of them were pretty well thought out. They looked at an MRI of a patient's knee before they've had any stem cell injections. Then they repeated those studies at 3, 6, and 12 months looking for cartilage growth after stem cells. You don't see much for that first 6 months, but at 12 months, almost everybody had thicker cartilage or cartilage growth, and they confirmed it with either the MRI or what's called a second look scope, where they actually look in the knee with a light. So we're getting two things happening with stem cells. The first is the most important thing. Those are the pain and anti-inflammatory factors that turn off the pain generators in the joint. Those occur pretty quickly, and that's what makes people feel better sooner. But if your question is, when is my x-ray going to go back to this? The answer is, it may never, but if it helps with cartilage growth over time, it should help with the cushioning of the knee. It may help with the appearance of the x-ray over time, but that's not a very quick fix in the regrowth department.
But some gristle or cartilage is better than bone on bone, obviously.
It is, but we have people who are pretty happy early, and we know their cartilage hasn't regrown according to studies. So we think it's what are called the anti-inflammatory effects of the growth factors that are in the stem cells, and there's quite a bit more in those than the other thing we talked about with the platelets.
Okay, so when you talk about stem cells, John, and you had mentioned there are different types of stem cells, where exactly would you get the stem cells from as an orthopedist that was going to do an injection to treat somebody with that problem? Can you tell me how we do this exactly?
Sure, Brian. First of all, we're going to call you in a medication that's a medicine to relax you. You're going to take that about an hour before you come and have someone drive you in. When you come back into the office, we're going to have you lay down on a table like this.
Like this?
Yeah.
Just
and
lay
then
down?
What I'm going to do is I'm going to come in with some my X-ray, my ultrasound machine, and I'm going to numb up an area on the back of the pelvis with some Novocaine, just like you'd get at your lip at the dentist. And what that'll do is numb up that area where I'm going to draw the stem cells.
I see.
You'll feel some pressure back there when we draw the blood. That area is then just covered with a Band-Aid, and you just lay there for about 15 minutes, and I go, Brian, are you comfortable? If you are, the spinner device takes 15 minutes to concentrate your blood. Then I say, Brian, once you sit up, and we're going to get our ultrasound, and we're going to take the stem cells and put it in the knee. We numb up that little area of the knee for you, put the stem cells in, and you're ready to go. So it takes about an hour in the office, and then whoever's here to drive you home. has a couple things for you, a couple mild pain medicines if you need them. We tell you to ice it and go home and turn on a ball game.
And that's it.
That's it.
You had mentioned that you do the stem cells from the bone marrow. Would I do that? Like if you saw me today and said, Brian, you have a arthritic knee, and you saw my x-ray, would I then go right back and you do a bone marrow aspirate that day and inject it? Or how does that work? How does the typical visit work when you give me that option?
Well, if you're seeing me for the first time, we do an initial evaluation. I examine your knee, I look at your films. If you have them and they've already been taken, you can just bring those with you. I prefer the actual discs or the MRIs if you have those. And after I talk to you, then I say, Brian, this is what I think you can do. And I review that your knee may have bone on bone and a knee replacement is an option. But there are safer options or less invasive or options that would delay having a joint replacement. So I would recommend a stem cell injection with some platelets because there's additional benefits of those anti-inflammatory proteins in the blood that we can get combined with the stem cells.
So you had just recommended to me that I get a stem cell injection in my knee. Can you show me on my knee where you would do that injection?
Sure, Brian. I would have you lay back. We would do it right on the outside part of the knee using an ultrasound to guide it into the joint. And then that's simply a injection of the stem cells that go into the knee joint, which is a capsule which holds all of it in that area.
So am I awake for this part of the injection?
You are. You've got a little area of the skin is numbed up with Novocaine, and that part numbs it up where the needle stick goes. And after that, it's like an injection you may have gotten with cortisone or a gel shot in the past.
Okay, so will I be able to walk out on my own?
You will. You'll have a little more fluid in the knee. There'll be about 4 or 5 cc's of fluid, so that fullness in there can make the knee feel a little tight, and you may limp a little. You have the option of bringing a walking stick or a crutch, but most people walk out.
Will I be able to drive home if I came myself?
I usually don't recommend that because if we do a stem cell, I give you an Ativan relaxing medication ahead of time. So we prefer someone drives you here and takes you home. The whole procedure would be done in inside about an hour, and the medicine hasn't really worn off at that point.
Okay. So can I go back to work that day?
I don't recommend that either. You've just had an Ativan, Brian. So I think the best thing is go home, take it easy. We tell people to not overdo it even the next day, not to be up more than about 30 minutes at a time that first day after doing stem cells.
So we've talked primarily about the knee. I'm here, you said I need it in my knee. But can I get PRP or stem cells in any joint that I have?
You can. They don't fit too well in small joints of the hand. One of my partners is doing a study on the base of the thumb joint. With platelets, you can only get about a drop or a cc or so in that small joint. But the stem cells are being done in predominantly, for me, the hip, shoulder, and knee. We are doing some ankles. There are people who do spine injections and some of the selective injections along the spine. You may have heard Jack Nicklaus went to Munich to get a stem cell injection in his back. So there are places that do more selective sites like the spine. Those are just emerging, I think, in some of the areas of the country now.
You know, so you had mentioned a total knee as an option. I have bad arthritis in my knee, and you said this may delay the need for me to have a total joint replacement. Is that correct?
Well, that's what I tell my patients. I think my job is to give you these options of what you can do for your problem. The injections, I go through those 4 things we just talked about: the cortisone, the gel, the platelets for mild problems, the stem cells for more severe problems. I tell them, you always have the option of replacing a joint. That's a hip, knee, or a shoulder. But these stem cells that can grow cartilage and cut down inflammation can delay that for many years. Our outcome studies in North America are in the 4 or 5 year category. We think it may be longer than that. We just don't have those numbers here because the technology is fairly recent in the North American market.
And one last question then, would you ever consider doing this on a family member?
Well, I have to say I've already done it on a family member. My wife's hip was, well, still is pretty bad. She was diagnosed with some hip issues years ago that were bad enough to need a hip replacement. I was smart enough not to be the one who was going to do it, so I took her to a doctor who said, yep, that's what you need. And she said, no thanks, I don't want it right now. And I put stem cells in my wife's hip 3 years ago, actually over 3 years ago. She still hasn't had her hip replaced. She takes 1 or 2 anti-inflammatories a month if she overdoes it, but she's pretty happy. She has her own hip. She's delaying what she knows is going to have to be a hip replacement someday, but her thinking is the longer she delays it, whenever she decides to do it, maybe it's going to last longer and not have to be redone it later in her life. So for her, it's worked out great. I'm living with it, so I know when things work or don't work, and I think she's a pretty good testimonial for what I've seen.
I hope you enjoyed this segment on stem cell treatment. For more information, please visit drjohnurse.com.